A man can survive a heart attack and still remember the names of his children. But when a stroke steals part of the brain, sometimes it steals the person entirely. I learned that lesson in the most terrifying way possible. Years ago, I was preparing for surgery when one of my colleagues suddenly collapsed outside the operating room. He was 62 years old, brilliant, respected, a man who had spent decades saving other people's lives. One second he was standing there talking normally, and the next, he was on the floor. His wife stood only a few feet away, and she froze. Not because she didn't love him, not because she didn't care, but because she didn't recognize what was happening fast enough. He survived, but the stroke stole 4 years of his memory. 4 years erased like someone ripped chapters out of a book. That moment never left me. And it's the reason I need you to stay with me through this video today, because what you learn in the next few minutes could someday save your brain, or the brain of someone you love. I'm Dr. Kevin Adewale. I've spent more than 25 years working in cardiovascular medicine. I've operated on hearts with my own hands. I've stood beside families during the worst moments of their lives. And after all those years, there's one truth I can tell you with absolute certainty: stroke is one of the most preventable medical disasters we face. Not preventable in the sense that it never happens. Life doesn't work that way. But preventable in the sense that the damage does not have to become catastrophic. And yet every single day, people lose their ability to walk. Remember, simply because they waited too long to act. That's the tragedy. Most people believe strokes happen suddenly without warning. But the truth is far more frightening. In many cases, the warning signs appear early enough to save brain tissue. The problem is people hesitate. They second-guess themselves. They hope it passes. And every second they wait, the brain pays the price. Right now, stroke remains one of the leading causes of long-term disability in older adults. Every 40 seconds, someone experiences a stroke. Think about that. Before you finish this paragraph, another family somewhere in the world will hear devastating news they never expected to hear today. But here's what haunts me most as a physician. The average person waits more than 30 minutes before calling for emergency help. 30 minutes. In stroke medicine, we have a phrase we repeat constantly: time is brain. Because during a stroke, millions of brain cells die every minute. Blood flow is interrupted. Not thousands, millions. Imagine a beautiful library catching fire shelf by shelf, while someone stands outside debating whether to call the fire department. That's what hesitation does to the human brain. And when I ask patients later why they waited, their answers are almost always the same. I thought maybe it was stress. I didn't want to bother anyone. I figured it would go away. I didn't want to seem dramatic. If you grew up believing strength meant handling problems quietly, I understand that mindset deeply. Many people over 60 were raised to endure discomfort without complaint. But stroke is one situation where silence becomes dangerous, because the brain cannot afford your pride. And here's the part most people never hear. When a stroke begins, not all brain tissue dies immediately. There's a critical zone surrounding the damaged area. Doctors call it the penumbra. I want you to picture it like the outer edge of a wildfire. The center has already burned, but the edges are still alive, weak, struggling, desperate for oxygen, but alive. And if treatment happens quickly enough, much of that tissue can survive. That means your memories can survive, your speech can survive, your independence can survive. But only if action happens fast. That's why recognizing symptoms immediately matters more than most people realize. The first few minutes after a stroke are not just medical minutes. They are life-defining minutes. The difference between walking again and needing lifelong care. The difference between recognizing your grandchildren and staring blankly at familiar faces. The difference between recovery and permanent loss. And unfortunately, stroke symptoms in older adults are often far more subtle than people expect. It's not always dramatic collapse or complete paralysis like you see in movies. Sometimes it begins with something small enough to ignore. A strange feeling in one arm. Sudden confusion. Trouble finding words. A brief moment where the room suddenly feels tilted. That's what makes stroke so dangerous. It often whispers before it screams. Most people think a stroke looks dramatic. They imagine someone collapsing instantly, unable to speak, unable to move, surrounded by chaos and panic. And yes, sometimes it happens that way. But after decades in medicine, I can tell you something that may surprise you. Some of the deadliest strokes begin quietly. No screaming, no collapse, no obvious emergency. Just one strange moment that feels off. And that's exactly why so many people miss the warning signs until it's too late. I once treated a retired teacher in her late 60s. Intelligent woman, sharp mind, completely independent. One morning she woke up and noticed her right hand felt unusual. Not painful, just weak and slightly numb. She assumed she had slept on it wrong, so she ignored it. She made coffee, read the newspaper, called her daughter to chat. Nearly 2 hours passed before someone finally realized she was having a stroke. By the time she reached the hospital, precious brain tissue was already gone forever. Later she told me something I'll never forget. I didn't want to overreact. That sentence has echoed in my mind for years. Because with stroke, the danger is not overreacting. The danger is waiting. And that's why I want to teach you a simple system that could one day save a life. Maybe your own. You may have heard the word F.A.S.T before. Doctors use it to help people recognize stroke symptoms quickly. But over the years, I realized something important for adults over 60. F.A.S.T alone often isn't enough, because strokes in older adults can appear differently. So I teach an expanded version called BE-FAST, and I need you to remember it. The letter B stands for balance. Sudden loss of balance or coordination can be an early stroke warning. Not ordinary dizziness from standing up too quickly. I'm talking about a sudden feeling like your legs no longer belong to you, like the floor shifted beneath your feet. People often describe it as feeling disconnected from their own body. One moment they're fine. The next they can't walk straight. That matters. The E stands for eyes. Sudden vision changes are incredibly important and frequently ignored. Blurred vision, double vision, temporary blindness in one eye. Sometimes it lasts only seconds before disappearing again. And that's exactly why people dismiss it. But temporary symptoms can be one of the brain's loudest distress signals. In medicine, we call these warning episodes transient ischemic attacks, or TIAs. Many people call them mini strokes. Symptoms appear briefly and then fade away, making the person believe the danger has passed. But what most people don't realize is this: a mini stroke is often a countdown timer. Nearly 1 out of 5 people who experience a TIA will suffer a major stroke within the next 48 hours, 2 days. Your brain may be warning you before disaster arrives. And then comes the part most people recognize. F.A.S.T. F stands for face. Ask the person to smile. Does one side droop slightly? Sometimes it's subtle. A crooked smile. A lip that won't move properly. Family members often notice it before the patient does. A stands for arms. Ask them to raise both arms at the same time. If one arm drifts downward or feels weak, that is a major warning sign. S stands for speech. This symptom terrifies families because it can happen suddenly and without explanation. A person who sounded completely normal 5 minutes earlier suddenly struggles to form words. Speech becomes slurred, confused, or strangely delayed. Sometimes they know exactly what they want to say, but their brain can no longer deliver the message properly. And finally, T stands for time. Because the moment any of these symptoms appear, the clock starts ticking. Not later, not after lunch, not after resting for a while immediately. But there's another symptom I want older adults especially to recognize because it doesn't fit neatly into the acronym. A sudden, explosive headache. Not an ordinary headache. Not tension. Not sinus pressure. I'm talking about a headache so severe it feels like something burst inside the skull. Patients often describe it as the worst headache of their lives. That can signal bleeding in the brain, what doctors call a hemorrhagic stroke. And when that happens, every second becomes critical. Now let me ask you something honestly. If you experience one of these symptoms right now, even just one, what would you do? Would you call emergency services immediately? Or would you wait 10 minutes to see if it improves? Your answer matters more than you think. Because hesitation during a stroke feels harmless in the moment. People tell themselves they're being reasonable, practical. But meanwhile, the brain is losing oxygen. Cells begin shutting down. Memory, movement, speech, personality. All of it depends on blood reaching delicate brain tissue without interruption. And the truly heartbreaking part is that modern medicine can often stop the damage if patients arrive fast enough. That's why recognizing symptoms early changes everything. Not tomorrow, not eventually. In those first few minutes, the moment someone realizes a stroke may be happening, panic usually takes over. And panic makes people do dangerous things. I've seen families rush loved ones into cars, force them to drink water, hand them random medications, even tell them to walk it off, because they assume movement would help. But during a stroke, the wrong action at the wrong moment can make brain damage dramatically worse. That's why what you do in the first few minutes matters, just as much as recognizing the symptoms themselves. So let's talk about exactly what should happen while waiting for emergency help to arrive. The very first thing is this: do not remain standing. If a stroke is beginning, balance and coordination can deteriorate suddenly. A person who feels mostly okay 1 minute may collapse the next, and a fall during a stroke creates a second emergency on top of the first. Head injuries, broken bones, internal bleeding. I've seen patients survive the stroke itself but suffer devastating complications because they fell trying to stay upright. So sit down carefully. And if sitting feels unstable, lower yourself to the floor slowly and safely. There is no pride during a medical emergency. Safety comes first. Now here's something many people don't know. Body position matters. If the person is awake and breathing normally, they should either sit upright slightly or lie on their side, not flat on their back. Why? Because strokes can interfere with swallowing almost immediately. Even people who feel alert may lose control of the muscles that protect the airway. That means saliva, water, or food can accidentally enter the lungs. And once that happens, choking or aspiration pneumonia becomes another serious threat. This is why medical teams often place stroke patients in what's called the recovery position, lying gently on one side, knees slightly bent, head supported. It helps protect the airway while waiting for paramedics. And this next instruction may sound strange, but it is critically important. Do not eat or drink anything. Not water, not tea, not even medication. I know that feels counterintuitive. People naturally want to help by offering a sip of water or morning pills. Families often think hydration will improve weakness or confusion. But during a stroke, swallowing can become impaired without warning. A simple sip of water can go directly into the lungs instead of the stomach. And that can become life-threatening very quickly. Now let's talk about the question I hear constantly from patients and families. Should I take aspirin? This is one of the most misunderstood parts of stroke care. The answer is simple. Not unless a medical professional tells you to. Here's why. Not all strokes are caused by blood clots. Some are caused by bleeding inside the brain. Those are called hemorrhagic strokes. And if someone takes aspirin during a bleeding stroke, the bleeding can worsen dramatically. That's why doctors must first determine which type of stroke is happening before medications are given. In the hospital, we use brain scans to make that decision safely. At home, guessing is dangerous. So until emergency professionals instruct otherwise, avoid taking medications entirely. Now I want to talk about something people rarely consider during a stroke: fear. The body enters survival mode. Heart rate climbs, blood pressure spikes, breathing becomes rapid and shallow, and unfortunately, that stress response can place even more strain on injured blood vessels inside the brain. That's why staying calm matters medically, not just emotionally. I know, stay calm sounds almost impossible during a crisis like this, but even controlled breathing can help stabilize the body while help is on the way. Slow inhale through the nose. Slow exhale through the mouth. Again and again. Focus only on the next breath. Sometimes giving the brain one simple task prevents panic from spiraling out of control. And if you're helping someone else during a stroke, your calmness becomes part of their treatment too. Speak slowly. Use short sentences. Avoid shouting or crowding around them. Patients experiencing strokes are often terrified and confused even if they cannot fully express it. Your voice can anchor them. Now let's discuss one of the biggest mistakes families make: driving the person to the hospital themselves. Please don't do this. I understand the instinct. People think getting in the car immediately will be faster than waiting for an ambulance. But emergency teams begin treatment before the patient even reaches the hospital. Paramedics can monitor breathing, oxygen levels, heart rhythm, blood pressure, blood sugar, neurological status, all while communicating directly with stroke specialists ahead of arrival. That preparation saves time. And remember, stroke patients can deteriorate rapidly during transport. Speech may worsen, consciousness may decline, breathing problems can appear suddenly. Inside a personal vehicle, there's little you can do safely. Inside an ambulance, trained professionals are already working to protect the brain. That difference matters more than most people realize. Now here's another detail almost nobody thinks about until it's too late. If you live alone, unlock your front door after calling emergency services. This single step can save precious minutes. I've seen paramedics lose valuable time trying to enter locked homes while a stroke continued progressing inside. If you can safely reach the door, unlock it immediately, then return to a safe position and wait. And if you have a trusted neighbor nearby, keep their number saved in your phone. Seriously, a reliable neighbor who can arrive quickly during an emergency may someday become one of the most important people in your life. Because strokes do not schedule appointments. They arrive without warning. Most people don't realize this, but the first words you say during an emergency call can determine how quickly treatment begins. When the dispatcher answers, don't describe every symptom first. Don't say, "I'm not feeling well," or "something feels strange." Say these exact words immediately. "I think I'm having a stroke." Or if you're helping someone else, "I think this person is having a stroke." Those words activate emergency stroke protocols in many systems. The right medical team gets alerted faster and hospitals begin preparing before you even arrive. Then give your address carefully. Speak slowly. Repeat it if necessary. Stroke symptoms can cause confusion or slurred speech, so don't feel embarrassed if speaking becomes difficult. Dispatchers are trained for this. And here's something critical. Stay on the line. Do not hang up after giving your location. The dispatcher becomes your lifeline until paramedics arrive. Even if you can't speak clearly anymore, leave the phone connected. Silence itself tells emergency teams something is wrong. If you live alone, this becomes even more important. Stroke symptoms can worsen suddenly. You may lose the ability to speak within minutes. That's why your first action should always be the emergency call before anything else. Then unlock the front door if possible and move somewhere visible nearby. I also strongly encourage older adults living alone to consider a medical alert device. Many people delay getting one because they associate it with weakness or aging. But in reality, it's protection, it's independence, and sometimes it's survival. One more thing, if someone is with you, ask them to note the exact time symptoms started. That single detail can determine which treatments doctors are able to use once you reach the hospital. Because in stroke care, minutes are not ordinary minutes. They are brain tissue. They are memory. They are life itself. And in the next part, I'm going to explain why waiting just a little longer becomes one of the deadliest decisions stroke patients ever make.